Laboratory, how may I help you?
Yes. This is the nurse calling from the floor. I just wanted to tell you that we are going to be putting in orders on a new admit in room 172. This patient has not been given an armband yet, but the doctor wants the report stat, so do you think you could come draw my patient's labs? I suppose I could get the blood with my IV start, but that is too much work for me being I am a busy floor nurse.
Sure, as soon as you put the order in for the test and armband the patient, so I have 2 forms of identification, I will come draw your patient's blood.
No. You do not understand. I need this blood drawn stat. I do not have time to put orders in for the test. You just come draw the blood and we can handle that later. Also, we have some urine you need to pick up from the station when you come this way. Are you coming to do my stat labs on my new admit patient that I have not yet given an armband?
As soon as you order the test and armband your patient, I will draw blood. In the meantime, I also have outpatients and ER patients to stick. I do have a job other than picking up urine for you while your co-workers sit around the nurse's desk doing nothing.
Our nurses are very busy. I also have some blood you need to pick up at the desk when you come along with the urine. You need to make sure you hurry before the blood hemolyzes. And on your way down here, can you bring me some flu swabs? I am a floor nurse who is very busy and cannot afford to leave this desk for any reason whatsoever. Please hurry before this blood hemolyzes. Again, I say hurry before this blood becomes hemolyzed.
Did I hear you correctly? Did you say I needed to come get the blood before it hemolyzes? Okay. Would you like for me to educate you on the definition of hemolysis? I do not think you understand. Did you forget where the lab is located? Let me remind you that there are 5 times as many of you nurses as there are lab techs, and I do not get paid to be your maid. So get up off your lazy butt and get your own flu swabs. You nurses drive me insane. You think you are so intelligent, but if you knew how ignorant you make yourself look to the laboratory, you would think twice before you said the things you say.
While I have you on the phone, can you relay the message to the blood bank that I am ready for Mr. Jones to rush at his next unit of blood? Will you ask them to thaw that unit out?
Thaw out a unit of bloody regret to inform you that we only freeze fresh frozen plasma. If you do not even know the correct holding temperature for blood, you may need to get someone else to assist you in giving the blood to your patient. Did nursing school teach you anything?
Yes. I said it correctly. You must have misunderstood me because I am a nurse. I know what I am talking about. I do not make mistakes, thank you.
Right.
Also, when you come to the floor, I need you to draw a stat glucose on the patient in room 151. I know he is a heart stick and cancer patient that has an arterial line, but it would be too much of an inconvenience for me to go draw the blood out of his arterial line for you. The patient is old anyways. Just come and stick him, and if you are unsuccessful, ask someone else in the lab to come stick him. Do not ask his nurse to handle the situation. Thank you.
Why would I even consider asking his nurse to handle the situation? The only result I would get from his nurse handling the situation would be a write-up to the lab, because the nurse would never actually address the problem, and it would be 2 days before anyone realized the labs did not get drawn. Then it would fall back on the lab because you nurses never make mistakes. I do not know why you people think that a title behind your name makes you smart. I would hate to know my life was in your hands. If that were the case, I better say my last words and know the outcome was not going to be good.